Good morning and welcome to Radio Friends. This is Tuesday, October the 21st, and even though we're two-thirds of the way through October, we want to bring up a very important message to you. October is Breast Cancer Awareness Month, and we are going to talk about a Mammathon that will be going on in November. So we're kind of extending Breast Cancer and Awareness Month into next month. Dr. Mark Travis is with us from MU Healthcare. Good to have you here.
Thanks for having me.
Now, the main reason you're here today is to let everybody know about this Mammathon. Let's talk about that first, and then I want to talk a little bit about breast cancer.
Well, I think every doctor will tell you that the goal is to catch cancer early because we know it's most treatable. And we know that breast cancer is very survivable when we catch it early. So what we want to do is remind women and get people involved in their preventative health by letting them know that mammography is really our best chance to catch breast cancer early.
Even better than the self-examination?
Well, they're used in conjunction. That's the second really important piece. But the mammogram is critical for us because we know that it's been shown time and time again to decrease breast cancer deaths. And so we want to give women every opportunity to get in and have their mammogram done every year to prevent or catch early
So you're
breast
saying every
cancer.
year?
Every year. Every year.
Starting at what age and continuing into what age?
Well, it is age 40 unless you are higher risk, and we can talk about that unless a very close family member, that changes when you should start. But originally it's age 40 for the general population, and you should have that every year your entire life. Now, when you get...
Even when you're in your 80s or 90s?
Yes, we still do that. And that is many women in their 80s are of generally good health and have many more years. And so if we can catch their breast cancer early, they won't die of that and they'll be able to continue on their life.
Okay, what are the chances of a woman who's lived to be 85 years of age and she's been cancer-free, what are her chances of being diagnosed with breast cancer at 85 or 90 years of age?
Well, they decrease as you get a little older. However, the majority of breast cancers, 4 out of 5, are diagnosed in women over age 50.
Is that right?
That's right.
Are there any warning signs besides the self-examination and mammography?
Yeah, there are. We always tell people that at the first of the month they should always do a self-breast exam because that's very important for them to find changes in how their breasts feel. But in addition to that, they can have dimpling of the skin or redness of the skin and something that looks kind of like an orange peel. Peau d'orange is kind of how I say it, but it's essentially a little kind of thickening of the skin, and it just looks different. So anytime you have a breast skin changes or a dimpling of the skin, you want to come in and see your doctor about that.
What about men?
Men do get breast cancer.
But not as often as women?
Not as often as women.
So how does a man check for breast cancer?
Generally, we diagnose men. Either they have felt a palpable abnormality, a nodule, or a lump in their breast, or their primary care physician, when they were doing a normal physical exam, found a lump and they wanted to get it evaluated, and they get referred to us, and then we work it up just the same as we do a female who comes in with a palpable abnormality.
Okay, let's say you discover breast cancer. What is the normal type of treatment? Is it radiation? Is it surgery, or is it chemotherapy? It's
a combination based on what type it was and where it was at, and are there lymph nodes involved and what stage it is. When they're earlier stage and lymph nodes aren't involved, or maybe one is or two, they consider breast conserving therapy. And that is you go in and you do a lumpectomy, or you take out that small cancer, and you sample some of the lymph nodes in the armpit, the axillary region, and then you can get chemotherapy and radiation after that. And then if while we're working up your breast cancer, we find other breast cancers, then you tend to consider other more aggressive surgeries like a mastectomy and things like that.
Now, I have a friend whose family history was breast cancer. She decided that she was going to have a double mastectomy Is this something that is recommended for someone who is a high risk of breast cancer?
I wouldn't say it's recommended, but it's an option. And the reason...
Is it a good option?
Yes. And the reason I say that is it's a discussion between a patient and a surgeon.
Right.
But we know that there are many genes that put people at very high risk of breast cancer, and the two biggest are BRCA1, BRCA1, and BRCA2. And the people with BRCA1 gene mutation have an 80% chance of breast cancer in their life.
So if you go in and have a double mastectomy, you are eliminating your chance
of breast cancer because
cancer.
you've removed the breast tissue. So a lot of women will have their children and become near 40, 45 when their risk really increases with the BRCA, and then they go talk to a surgeon and discuss whether that's the right choice for them or not.
That's a pretty big decision to make.
It is a big decision.
And it's an emotional decision.
It's an emotional decision, and it's usually best done with family and the breast surgeon. And a few people I know have done it, but it's taken them a while to get to that decision point after multiple visits to their breast surgeon and things like that. But it's very reasonable in somebody with a 8 out of 10 chance.
We're almost out of time, but I want to end this on a very positive note. So many advances have been made in the treatment of cancer, right?
Yes.
When you're diagnosed, or if you are diagnosed with cancer, chances of surviving that cancer are much better today than they were even 5 years ago, correct?
They're fantastic now. We have stage 0 and stage 1 is 100% 5-year survival. Stage 2 is above 90%, around 93%. And so if we can get people in to have their mammograms and do those monthly self-breast exams and we catch them early, they can have a long and fruitful and healthy life, which is what everyone's goal is.
Doctor, thank you so much for coming by. Mark it on your calendar, November the 7th. Friday, that's Friday, November 7th, 6 to 10 p.m. They should call ahead of time.
Yes, and
make
I
a reservation.
I have
What's
the number? 573-882-8511.
Okay, that's for the mammogram. November 7th, Friday, 6 to 10 p.m. Call ahead of time, make your reservations. It could save your life. Dr. Mark Travis, thank you so much for coming by. Pleasure meeting you, and you were just outstanding with information.
Thanks.
All right. Tomorrow, resident arts and empty bowls will be our topic. Our program directed by Travis McMillan, Reynolds Journalism Institute. Audio is Pat Akers from KPIA. Our floor director is Lowell Thomas, and our assistant producer and guest coordinator, Uncle James Mauser. See you tomorrow.